Enhancing atrial activity detection in dogs. A detailed summary. Accurately diagnosing supraventricular arrhythmias is a crucial aspect of veterinary cardiology. Conditions like atrial fibrillation, AF, atrial flutter, AFL, and atrial tachycardia can be challenging to differentiate based solely on standard electrocardiogram (ECG) readings. This challenge arises from the complexities in interpreting the subtle electrical signals that represent atrial activity, especially when analyzing short ECG recordings. In human medicine, the Lewis lead has proven invaluable in highlighting atrial depolarization waves, aiding in the diagnosis of AF and AFL. However, this technique cannot be directly transferred to canine patients due to interspecies differences in cardiac anatomy and electrical access. Therefore, the development of a canine-specific method for enhancing atrial activity detection on ECG is highly desirable. Study design and objectives. This study, conducted by Kuragachi et al., focused on developing new bipolar lead configurations optimized for evaluating atrial depolarization in dogs and comparing their efficacy to conventional ECG leads. The researchers hypothesized that a lead configuration capable of producing a high absolute P wave value P coupled with a high P wave to QRS complex ratio P.QRS would effectively isolate and enhance the visualization of atrial activity. The study involved 6 healthy laboratory beagles, all intact males, with an average weight of 10.8 plus or minus 0.8 kg and age of 70 plus or minus 0 months. Prior to the study, all dogs underwent thorough physical examinations and a panel of blood tests to ensure they were clinically healthy. Ethical approval for the study protocol was granted by the Laboratory Animal Experimentation Committee at Azabu University. ECG recordings were performed with the dogs in a conscious and standing position using a standard 12-lead ECG unit. To minimize stress and ensure consistent recordings, no sedation was used. 2 separate recording sessions were conducted for each dog. Session 1. 6 unipolar electrodes were placed on specific precordial locations, while 4 bipolar electrodes were used for standard limb lead recordings. Session 2. Electrode placements were adjusted to implement the novel bipolar lead configurations. Conventional ECG methods involved recording data from bipolar limb leads, I, 2, 3, and augmented unipolar leads, AVL, AVF, AVR. Additionally, unipolar precordial leads, C2, C3, C4, C5, C6, M1, M2, M5, M6, first R, CV6LL, and V10, chosen based on previous research, were also employed. The precise placement of these electrodes is detailed in Table 1. Figure 1a illustrates the conventional lead configurations used in the study. New bipolar leads, designated M6M1 and M6M2, were derived from Takahashi's unipolar precordial lead system. M6 served as the negative electrode for both configurations. M1 was the positive electrode for M6M1. M2 served as the positive electrode for M6M2. Figure 1b depicts the placement of these new bipolar leads. For each lead, various ECG parameters were meticulously measured and analyzed. These included heart rate, QRS complex duration, P wave duration, PQ interval duration, QT interval duration, T wave amplitude, mean electrical access, amplitudes of the P, Q, R, and S waves. Additionally, P, QRS, and the P.QRS ratio were calculated. Statistical analysis was conducted to evaluate the reliability and significance of the data. Intra-class correlation coefficient ICC, used to assess the consistency of ECG measurements within each dog. Repeated measures ANOVA and Dunnett test, for normally distributed data, or Friedman test and Steele test, for non-normally distributed data, used to compare values obtained from new bipolar leads versus conventional leads. Results, highlighting atrial signals. Table 2 presents the calculated ICC values for the P, Q, R, and S wave amplitudes for each lead. Notably, the ICC values exceeded 0.75 for most leads, signifying a high degree of intra-rater reliability, except for the P wave in lead first R, which exhibited moderate reliability with an ICC of 0.74. These results confirm that the data obtained from the ECG measurements were consistent and dependable. Table 3 displays the P, Q, R, and S wave amplitudes for each lead configuration. A key observation was the tendency for higher P wave amplitude in M6M1 compared to most conventional leads, with lead I being the exception. Similarly, M6M2 also exhibited higher P wave amplitude than most conventional leads, except for leads I, 2, AVF, and C3. Statistical analysis revealed significant differences between the new bipolar leads and many of the conventional leads in terms of P wave amplitude. Table 4 provides the P, QRS, and P.QRS values for each lead configuration. The findings indicated that P values in the new bipolar leads, M6M1 and M6M2, were significantly higher than those observed in most conventional leads. QRS values were higher in leads 2 and C3 compared to M6M1 and lower in AVL, M5, and M6 compared to M6M2. QRS values in M6M1 were significantly higher than all conventional leads except M6. The P.QRS value in M6M2 was higher than those obtained from leads C5, C6, and CV6LL. These results strongly suggest that the new bipolar leads, particularly M6M1, effectively enhanced P-wave visualization without undesirably amplifying the QRS complex, achieving a more favorable signal-to-noise ratio for atrial activity detection. Discussion: a step towards improved atrial arrhythmia detection. The results demonstrate that the new bipolar leads, M6M1 and M6M2, successfully enhance the P wave while minimizing QRS complex amplification. This capability makes them potentially valuable tools for specifically identifying and analyzing atrial activity during normal sinus rhythm in dogs. The authors propose that the effectiveness of the new bipolar leads stems from the strategic positioning of the electrodes in relation to the heart's anatomical location within the thorax, and the distance between the electrodes and the heart's surface. This placement optimizes the capture of atrial electrical signals while reducing interference from ventricular activity. This study builds upon and corroborates previous research on precordial lead configurations in veterinary medicine. The observed negative P waves at M6 in this study align with the findings reported by Takahashi in his pioneering work in 1964. Furthermore, the results are consistent with prior reports on the modified Lanik system and the modified Wilson precordial lead system. The study authors suggest that M6M1 and M6M2 hold great promise as supplementary lead configurations in veterinary ECG practice, potentially improving the identification of P waves without the confounding influence of amplified QRS complexes. These new leads could be easily integrated into existing standard 6-lead ECG protocols by repositioning the electrodes, enhancing the diagnostic capabilities of even basic ECG setups. This accessibility makes the technique particularly relevant for a wide range of veterinary settings, from general practice to specialized cardiology and emergency care. Study limitations and future directions. While promising, the study acknowledges several limitations. Firstly, the study was conducted on a small, homogeneous group of healthy beagles, raising concerns about the generalizability of the findings to other dog breeds and dogs with pre-existing cardiac conditions. ECG patterns can be influenced by breed-specific variations in thoracic conformation, potentially impacting the effectiveness of the new leads. Secondly, all recordings were performed with the dogs in a standing position. Body position can influence the electrical access of the heart, and further research is warranted to evaluate the performance of these new leads in different body positions. The study primarily focused on enhancing the detection of regular P-wave activity, and did not evaluate the performance of the new leads in cases of arrhythmias such as AF, AFL, and AT. Further investigation is necessary to determine the efficacy of M6M1 and M6M2 in accurately identifying and characterizing these specific arrhythmias. Conclusion. The study presented by Kuragachi et al. Introduces M6M1 and M6M2 as novel bipolar lead configurations that show significant potential for improving the detection of atrial activity on ECG in dogs. By maximizing the P.QRS ratio and enhancing P-wave amplitude, these leads provide a clearer visualization of atrial electrical signals without amplifying the QRS complex, facilitating more accurate interpretation. Further research is needed to explore the applicability of these leads in various breeds, different body positions, and clinical cases of arrhythmias. However, the initial findings suggest that M6M1 and M6M2 could become valuable additions to the veterinary electrocardiography toolbox, aiding in the diagnosis and management of cardiac conditions in dogs. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.